So first, this is my metaphor for science. It's a bicycle race. Let's imagine it's the Tour de France. And you've got this huge group of riders in the back. And these are people who are kind of good scientists. They're advancing things a little bit. In the front, we have two riders who've broken away from the pack. In science, the people who break away are the people who are the huge innovators. And Diego is one of those, and he's going to talk to us about that. But when you're out there by yourself, there's huge risk to being out there on your own.
I actually became very interested in the nervous system, particularly because it was very little known at that time of how it is that our gut senses the nutrients that we eat. How little we actually know about how it is that food up here alters up here and drives up here. And the same way how up here drives down here. And that's what we have been chasing in the laboratory.
In the Alzheimer's world, there's evidence that this wave of obesity that's moving through midlife right now is going to be a huge risk factor for Alzheimer's disease. Any thoughts on that?
Yes, there is quite a bit of emerging evidence that some of the, not only the food, but some of the connections of the gut with the brain are involved in neurodegenerative diseases.
Which I learned preparing for this session from Diego.
Yeah, and in fact, Rich probably can talk a little bit more about it. Alzheimer's is certainly an area that is emerging. Parkinson's now is well documented that up to 7 years before you can see the symptoms in the brain, you can actually see them in the gut. And that if you sever this main connection, the vagus nerve, it actually, the incidence of Parkinson's slows down. But we really are starting to just tease apart like how it is that these connections are happening.
So our chancellor and our dean has set up these initiatives called Translating Duke Health. One of them is in the area of neuroscience. And the idea behind the neuroscience is to understand what powers the brain has to heal itself. This slide shows you a 70-year-old person. And you can see in the left side of the brain, there's that arrow with the white dot. And that's a very small stroke. That teeny little stroke probably means that the patient is not going to be able to move their right arm very well for the rest of their life. Now look at this next slide. That's not a mistake. The 7-year-old girl had half her brain removed for a condition called Rasmussen's encephalitis. But you'd imagine that that surgery would leave the child profoundly hemiplegic on the right side and possibly unable to speak because language is in the left part of the brain. And initially, that is what happens. But the report shows that after 3 years, when this child comes back from follow-up, it is very difficult to tell that anything has happened. She's walking, she's talking, she sees, she plays. And that's half of a brain removed. Yet in a 7-year-old, a very small stroke can have devastating long-term effects. We also think that those are the reasons why you develop diseases like Parkinson's and Alzheimer's disease, because your brain is losing these youthful resiliency factors, and that the people who develop those diseases lose them at a greater rate. I mean, age, in terms of the biology of the brain, is an actual something. We don't know for sure what that something is, but we need to find them out because it's those somethings that make the difference between a 7-year-old and a 70-year-old. So here's what we need to understand. It's this aging transition between when you have a completely normal brain and when the earliest pathologic changes happen. So this idea that it's the old model where you get amyloid and tau completely leaves out all these risk factors, like what does sex have to do with amyloid, or what does age, or what does midlife obesity? Well, they all have to do with different metabolic processes. Can't I take a statin and make it go away? And the answer is no, not at this point. But in 20 years, I'm convinced, yes, there will be medications to interfere with these pathways and prevent these diseases. But it's going to take a village. I'm confident that we're going to make some really big changes, and I see such young, talented people like Diego at this institution, and that just reinforces my beliefs.
Thank you.